The Ebonyi State Commissioner for Health, Dr. Ekuma gives scorecard of Nwifuru led administration impact in the health sector in the administration's less than 2 months to be 2 years in active service. These include recruitment of various cadres of health workers, procurement of full equipped brand new ambulances for emergency services, procurement of brand SUV jeep for state medical officers, provision of standard health equipment and consumables, provisions of health insurance for Ebonyans, revitalization of state general hospital and health centers, purchase of motorcycle to officers in charge of various health centers, revitalization of state cold room for effective vaccine storage, sponsorship for virus-free surgery in Ebonyi State, payment of counterpart funds. Stay tuned as the Commissioner for Health, Dr. Ekuma take you down the lane, including the prospects in the ministry.
His Excellency, right Honorable Francis Ogbonna, I can describe you as regional governor or public governor in my language. Because when we came on board, as when I assumed office as the Honorable Commissioner for Health, I went around the whole of 14 general hospitals then, now Nwifuru. And I discovered what I call the major challenges in the health sector. Because you cannot be talking of the health sector when there is no manpower. You cannot be talking of the hospital when there is no equipment. You cannot be saying you have hospital when there is no drugs. And these were major challenges. And without wasting time, the governor came in and started with employment of medical personnel. He had few doctors, less than 7 doctors in the whole state. So but when he came in, that narrative changed. Not only doctors were employed, nurses employed, pharmacists, lab scientists, and other paramedics. And we did not only employ, because if we employ, because of the Japa syndrome now, we don't take care of the health workers, we employ them today and they leave tomorrow. So we also retain them by giving some incentives. We procured the SUV for the doctors. We started rural allowances for those health workers that are outside the state capital, those ones who posted outside the state capital. Then as that is not enough, we provided fuel allowance for the medical officers to help them fuel their vehicle. As if that is not enough, we started renovation of health workers' quarters in our general hospital, such that the people can easily relax there. As we speak, those quarters are not comparable to some of the houses people are renting in Abakaliki urban. All these things were aimed at retaining the health workers in the health sector. And because we not only employ, we say, okay, we can employ these people today and tomorrow they leave. So because of that, we say, let's do something to retain them. And that paid off, because as we are saying, as we are speaking, in some states, health workers are leaving the states, but in Ebonyi, health workers are applying to join Ebonyi State Ministry of Health. I have 8 applications pending. Johnson, and even few people came down from the popular Saudi Arabia. They are in our service, in the service of Ebonyi State Ministry of Health, because they noticed that there is no need staying there. So they came and joined us. And we also made plan for long-term plan to retain health workers in the state. What do I mean by that? We have 2 health training institutions in the state. That is the College of Nursing, Ubru, and School of Health and Technology. So we gave some students scholarship in this institution, such that when they graduate, they will work with us before, even if they want to leave, they will now leave. Because all these ones are like long-term plan. We gave them scholarship. When they graduate, they work with us. And it's not only that, we upgraded those schools. Before I came in as a commissioner, School of Nursing Ubru was just School of Nursing, offering nursing sciences only. I said you cannot train only nurses, we also need midwives, because midwives are those ones that take deliveries. And you cannot be only training, you cannot be training only nurses, and we also need to train the midwives. So we now invited the council that is in charge of midwives, and they came. They inspected the school, gave us what we have to fix in the school to actually allow them give us accreditation to train midwife. That was quickly done, and they gave us that approval to train 80 midwives. Meanwhile, when we came in, the school was only training 80 nurses. They now upgraded that of nursing students to 120, and they now give us 80 chance to train 80 midwives. You understand? So that school now became a school of nursing and midwifery. Then we also discovered that we've not gotten to where we want. Because some of the nurses will look at it, oh, I'm not good to that school because when I graduate, I will not be able to do youth service and assume the status of a graduate. We say no, let's now upgrade it to College of Nursing, which is like polytechnic. So that school now awards is now get HND. That is like a polytechnic. It's a polytechnic monotechnic because it's not training. So it's now awarding higher national diploma. So and you can now gain admission into that school through JAM. So that place is now College of Nursing and Midwifery. So courtesy of the present government. All these things were aimed at addressing the issue of manpower in the health sector. The same thing with the College of Health Technology, Izambo. We went in, we looked at the place, many things has gone wrong there. Has went wrong before we came in and said, okay, let's know what we are going to do. And we started. As we speak, we've gotten accreditation for the 3 courses that are being offered in that school. That is the community health program, the health information program, and that of environmental health. We still plan to add other courses like laboratory technology, X-ray technician, pharmacy. You understand? So these are things we plan to do there so as to produce more manpower in the health sector, because the way things are going, health workers are leaving the country every day. So one of the ways to tackle that is to produce more, and the state government is doing that. So that's about the manpower in the health sector, because it was one of the major challenges. Then the second one was equipment. You cannot be talking of you have a hospital when there is no equipment. The doctors, they don't work with their hand just like that. You need those equipment to help you make your diagnosis and treat the patient appropriately. And when this administration came, we went around, took inventory of all the things in our health facilities. We are not just following it sheepishly. We have to. All we are doing was more of evidence based. So okay, see what we have. Now see what we're supposed to have. So when we now compare it, we know the gap. We now know started filling the gaps. And those things were compiled, including the modern equipment, the heavy lifting machine like MRI, CT scan, and so on. And those things were costed and contract was awarded. As we speak, the ministry has taken delivery of equipment worth billions of naira, and we are still expecting, especially the heavy machines. So, with what we have now, at least we don't have problem of diagnosing common ailments in the hospital or common medical condition. So the third major challenge then was drugs. You look at it. I came in, I said, you cannot be talking of give some money to one person to go and buy drugs. The person will buy maybe from the friend at a very high price, and when we bring it to the hospital, nobody will buy at that. I said, no, let us establish an agency that is backed by a law. So we made a draft of a bill and sent to the House of Assembly to establish an agency called Drugs and Medical Commodity Management Agency. So that bill was sent to the House. We went through the process then in the House of Assembly. The bill was passed and was sent to the governor, who now signed it into law. So we now have that agency. In that law, we've made it that we are going to procure drugs directly from manufacturers. Two is that all the public health facilities in the state, especially the state-owned, must procure their drugs from the agency, because we are going to get it directly from manufacturers. By so doing, we are sure of the drug not being fake. We are sure of the price will be lesser, and also will help us know that that the drugs are not fake. So, and we made it such that all the health facilities are going to, the government-owned health facilities are going to procure directly from that, get directly from our central medical store. Because after that bill, we now created a central medical store, a large warehouse, where we now get our drugs, and the health facilities can pick their own. And they are not going to sell at any price they like. Pegged it 7.5% markup, which you cannot get in any pharmacy in town, even from the dealers. 7%. What that means is that if you buy this drug at 1,000 naira, what the person will add is 1,075 naira, 7.5%. That is what the markup is. So it's not like, since it's already a law, you don't need to change it. And out of that money, some percentage is for the running cost, while the other one will still go back to the revolving fund. And he says, we recently approved hundreds of millions of naira for the revolving fund. And we are hoping that with time, we now start supplying to private facilities, because it's also one of our own initiative of fighting fake drugs in the state. Because when we are procuring directly from the manufacturers, we actually know what we are procuring. So that is another critical area. And the fourth thing is that, after doing all these things, and the patient don't have money to go to hospital, we still not come. We look at it. We say, what are we going to do to improve patient patronage? Is to enroll the less privileged into health insurance, such that they will not need a fund to pay for their hospital bill. What they need to do is to go to the hospital with their enrollment cards. And apart from the vulnerables, especially the pregnant women and the under five children. When I came in, those things were less than was 600 and something. But as we speak now, we have over 40,000 enrollees because the governor also enrolled all the state civil servants into health and insurance. So, and also our mother, the mother of the state, Her Excellency Chief Mrs. Mary Modern, through her pet project, Bill, has been enrolling people. The sickle cell patients, the some vulnerable pregnant women, the aged men and women. So those things have boosted up our enrollment, the number of our enrollees. And some well-to-do individuals have decided to adopt life. Like you see some top politicians who can enroll like a large number in their own community. So because of our advocacy, so they don't know with that. People don't always have that issue of how would they get to them or how would they access healthcare. But what they need is their enrollment card to go to hospital. And these four things were major challenges I faced when I came in. Because we go to hospital, no nurse, no doctor. Finally, you see them, no drugs, no equipment. So, but all those things has been, and it's paying off because as we speak, Ebonyi State is one of the states where the number of people delivering in the hospital has markedly increased compared to what it was. And you now come to area of preventive medicine because they say prevention is better than cure. And we look at the immunization. You say, okay, we have to make sure that 100% all the people that are supposed to receive immunization, that they receive immunization, even though we've not achieved 100%, but we are on it. We decided to buy motorcycle and give to those health workers in rural areas so that they can access how to reach area and give children immunization. Then we now looked at our cold room because giving immunization is one thing, but giving the making sure that those things we are giving are at the optimal condition where they're supposed to be, because those vaccines, if you temperature can actually affect the potency of those vaccines. So we now look at it and say, okay, there is vaccine cold stock, and we'll be managing. Before we came in was with public power supply. Because and you know how public power supply in Nigeria is very eclectic. And because these vaccines are sensitive to temperature, we say no. That we want to store it optimally such that if we give any child immunization not so potent, to zone approved for complete solarization. When I say complete solarization, I mean giving even the ACs, the cold, the fridge, all those things that are supposed where we store our food, the room itself, can take a look at it, it's completely solarized. So we have uninterrupted power supply in our cold store. What is the aim? The aim is that when we get these vaccines, we are sure that we are giving the children what they're supposed to receive, nothing less. Because when you store this thing under temperature that's not stable, so you know it will turn to a different thing. And also still in the area of that immunization, the governor has been paying a counterpart fund. So these are some of the things we are doing in the health sector, and we now look at All the general hospitals, there are ambulances all over. And what's the aim of this? The aim is that this new hospital can handle all kind of medical condition. If there is any condition that is above the general hospital, that patient can easily be transferred to the tertiary health and facilities. So that is the essence of those ambulances for prompt referral. And when we come to the primary health centers, when we came in, we decided to select one for each INEC recognized political ward. Because some people will tell you that they don't know where their own is, thinking that it's this other ward maybe they created during the government. No, it's INEC. Every INEC recognized political ward selected one health facility. And that came to 171. So, and we fix some things there to make it better than the ones that are not selected. But having done all those things, we still look at it that we want more comprehensive health centers in Tutu, in every local government. When we talk about this comprehensive one, we want a health center that will have quarters, we have the clinic house, will be fenced, there will be water there, then security, the gatehouse and the security man, solar, 24 hours power supply, and even blood transfusion, and some higher medical procedures can occur in those facilities. So that is where we are now. We have 26 of the selected facilities. That is 2 per local government, and the contract has been awarded. In less than 2 weeks now, we do the flag off. So because we want those two in the local government in addition to general hospital, it will just be like a mini a comprehensive health center. That is what we want it to be, comprehensive, such that it will offer services higher than what you see in normal health center, because we cannot carry all these things at the same time. And these new ones we are talking about, two in local government, we say no, we are not going to site it in a fresh place. We still in some of these old facilities, we will now upgrade it, fence it, put gates, gate man, 247 lights and water, then quarters for the staff, then block the blood bank in services and all those things. Because we discovered that PPH, bleeding following delivery, is one of the major causes of maternal death, and our major aim is to reduce maternal death and under 5 death, because as we all know, pregnancy is not a disease. So somebody's not supposed to die by going to give birth or delivering. So it's a very painful death. We don't want it, but I'm happy that since we came in with our intervention, we've really reduced the number of maternal death and under 5 death, because we also discovered that for this under 5, nutrition was also a challenge. So, and the government did not waste time to pay hundreds of millions as counterpart fund for nutrition activities. So we are partnering with Helen Keller and other people to treat malnourished children. So I'm really happy, and I thank His Excellency, Executive Governor of Ebonyi State, for what he has been doing in the health sector of Ebonyi, and what he's still doing. Because what we plan to do, because some of these, like the cold chain here, we still want to replicate cold room in all the zones. so that during vaccination, people don't need to come from Eda to Abakaliki to collect their vaccine. We want to have in each senatorial zone in the budget of this year. Very soon we start the work, but we've not started now. But the ones I've told you, we've done on it. So I thank His Excellency the Governor, the wife of the Governor, for their interest in the health of Ebonyi residents, because you must be healthy to talk of other things. We are going to school, talking of promoting economy, consulting road and all those things. We have to, and I thank God that the governor understands the importance of the health. Little above 12 billion in the health sector, but it's not was not 100% implemented. So it's difficult for me to say the exact amount now. And the health sector is still not like all these other ministries, like housing. You can just give contract, you see everything going. Roads, you see people. Most of the what we do, the Minister of Health is more of service and delivery and all those things.